So that is while we are in this class, we need to know where to trash some of our stuffs. Okay, so we have 3 trash receptacles. Can you see? We have the regular trash, we have the red box, and we have the sharps container. Okay, so we have to trash into these areas. So I was doing with, so just I want to repeat some of this so that you know where we trash our stuffs. We do some exercises here. Okay, let's you do it, okay? For those that know it already, so you don't need to do that, okay? Now, for you, Suzuki, can you put, so you know we have these 3 receptacles. Well, this one is the sharps container, okay? This one is the biohazard container, this one is the regular trash, okay? So, which of these do we throw here, which of these here, which of these here? Okay, that's the question. Now, where do you throw this one?
Bills.
Huh?
Bills.
This one, biohazard, okay? Biohazard, so it's here. And this is gloves with, this is bloody stain, okay?
Gloves should be also regular.
No, because it has blood, can you see here?
Yes.
It has blood, yes? So we have to throw it where? In the biohazard. This is a plastic pipette.
Should be in the first one as well.
It has blood.
No, it doesn't.
So where do we throw it? We throw it the same biohazard, okay? This one is like a glucose testing strip with blood.
It has some, yeah.
Where
I think it's for checking the blood.
Yes. Where do you throw it? After you test it, because it has blood here. So where do you throw it?
Biohazards.
Yes. And this one, this is a cotton ball. It has
also blood.
Blood. Where do you throw it?
Biohazards.
This one is a plastic aliquot tube with blood.
It should be biohazards.
Biohazard. This is a butterfly needle.
It's the first bag.
Here, sharps container. This is evacuated tube needle.
That should be also the first bag.
And this is evacuated tube.
It's also the first, I think.
Yes, the first one because it's a tube.
Yeah.
Okay, this is a syringe.
Syringe is also the first.
This is alcohol clean pad.
Alcohol clean pad should be the hazard.
No, because it doesn't have blood. Can you see? No blood. This into regular trash. This one.
This is also the last one, the regular.
Here, and this one is empty testing strip container.
It's also biohazards.
No, because it doesn't have blood. It should be regular trash. This is disposable tourniquet. No.
The regular.
Yes.
The last one.
So that's how we throw. Okay. That's how we throw, and we need to know which things to throw where. Okay. That's very important. Okay. After we do this one, so that's how. So let's go to medical history, measurement, and vital signs. Okay. So in this class of medical assisting, we take what? Medical history. That means we take the history of the patients. Okay. And we do measurements and we do vital signs. So we have some steps here to do that. The first one is start with the chief complaint. Okay. Then do weight and height. Then do vital signs. Okay. So we have 4 vital signs. What are they? These are temperature, pulse, respiratory rate, and blood pressure. Okay? These are called the 4 vital signs. So that means these are the ones that we check on patients. So what does vital signs show? Vital signs shows us the homeostasis. That means whether there is a balance in our body system. Okay? So when we have a chief complaint, how do we proceed? Okay? How do we ask a chief complaint? Producer will tell us. Can you tell us? Can you? Well, what do you say if you want to ask?
Oh, like what are you here? What brings you in today?
Yes.
And then ask them what are you, like when they tell you what the significant reason, like they have a sore throat. How
Yes.
long did you have it for? What have you been taking for it?
That's how long.
Yeah.
First we ask what? How long, okay? So that means what brings you to the office today? Or what's the problem today? Okay? Let's say if she's telling you I have headache, okay, for how long was that? 3 days, let's say. So headache for 3 days will be the chief complaint. Okay? Then after you take chief complaint, you do what? HPI. HPI means history of present illness. Okay? History of present illness. So what do you ask in this history of present illness? It means you take the chief complaint and ask what happened from the onset up to now, what happened? How has the illness progressed? And what did you do for that? Did you take like medications? Did you do sleep or did you do diet? Okay, what did you do for that? You see, people are doing anything for if they are sick, if they are ill, yes? Okay, they do something. So that you ask them, okay, which things they do to relieve their condition or to relieve their problem. Okay? Okay, if some patients, if they have pain, then you ask them for what we call a pain scale. Okay, what do you mean by pain scale? Pain scale means the intensity of pain. How much is their pain? Okay, it's just a subjective representation. Subjectively, they tell you I have a pain scale of 8, 6, 4, 5, 2, 1. Okay, so that's called pain scale. And if they have pain also, you need to characterize the pain. That is, what kind of pain is that? Okay, they might tell you throbbing pain, cramping pain, pricking pain, pinning pain, angina pain, migraine headache. Okay, so like that. And also for pain, ask for radiation. Radiation means whether the pain moves to somewhere else or not. Okay, let's say if they have the pain here on the stomach, you can follow it. You can follow. I gave you
The book,
Yeah, I gave you the handbook.
medical assistant book.
Yeah. No, the student workbook. The student book.
Oh, okay.
So just you can follow me.
The
But
first
yeah,
one.
okay.
First one.
Which one?
Oh, yeah. I follow. I can follow. Thank you.
Okay, that's what. So we need to characterize the pain. So these are some frequently asked like questions for different presentations. Okay, what are the commonest like symptoms that patients present? One is pain. The second, patients they can come with fever. Third, patients they can come with cough. Okay, they can come with what? Urinary complaints, urinary problems, and with diarrhea, vomiting. Okay, there can be lots of complaints, but here are some of them. How you ask some questions for that. Okay, let's say for pain, as we discussed, what did you ask? One, characterize the pain. What kind of pain it has, and then pain scale and radiation. Okay, these are important. Then if fever, ask them if the fever stays the whole day the same, or if it is coming up and down during the day or during the night. So we call it as intermittent, remittent, continuous, relapsing fevers. Okay? Then cough. Ask, the first thing that you need to ask is that if the cough is dry or what's called purulent.
Yes. Dry means that Whether can mucus.
Yes.
Dry?
Dry is if there is no like any mucous secretion or any sputum. Okay, that is called dry. If it is purulent or it's like there is secretion. Okay, I mean, especially we call it as dry or productive. Productive, okay. And if it is productive, you ask them if it is just clear or purulent. Okay, so purulent means usually it's like pussy kind, like, okay, like because of like infections. Okay, you can have a purulent. So ask if it is dry or productive.
Dry.
If it is productive, ask whether it is purulent or not. And ask also if it is productive, how much is like in the amount, how much do they expect for it? Okay? Okay? Let's say that they can tell you with certain container and so with cup of coffee like size, okay, they will tell you this much. Okay? So that you know like, okay, how much they expect us in a day, and the severity also, you know, with that. Ask also if it is bloody or not. Okay, sometimes some patients they have a bloody expectoration from inside, like bloody, or some sputums are bloody streaked. Okay, so usually some causes of bloody streaked or which is called hemoptysis. Hemoptysis means if there is blood on the sputum, it's called hemoptysis. Okay, hemoptysis. Hem means what? Blood. Phthisis means to expectorate. For example, tuberculosis is one of the causes. There is what we call Rasmussen's aneurysm. When there is this Rasmussen's aneurysm in the cavitary lesions of the tuberculosis, okay, in the lungs, okay, they burst or they rupture, okay, and then there will be bleeding from the lungs. Another cause is cancers, lung cancer, okay. It can lead to bloody sputum. So that's why we need to ask, okay, is that bloody or not? If it's bloody, really that's a serious condition, okay? And the other symptoms the patients can come are with diarrhea or vomiting, okay? So you ask them in this case, how frequent do they go to the bathroom? And what is the consistency of their stool? Is that mucoid? Is that watery? Sometimes rice water, okay? In case of cholera, for example, you have that rice water appearance, bloody, okay? If they don't have diarrhea, you can ask also the stool, color of the stool, like blackish or tarry stool, or which is called melena. Especially if there is what we call upper GI bleeding, when they have bleeding here on the upper GI, on the stomach, okay? They can have their stool like tarry color. It's called melena. It's called melena.
And also we should ask that during the diarrhea, during use